to this month's video on ACL injuries. My name is Sekwang and I'm one of the musculoskeletal physiotherapists here in Rehab Concept. ACL stands for the anterior cruciate ligament. This ligament runs through the middle of the knee and prevents the tibia or your shin bone from sliding forwards over the femur or the thigh bone. Okay? So it plays an extremely important role in stability of the knee joint. Now in terms of anatomy, it originates from the back part of your thigh bone and attaches to the front portion of the top of the shin bone. How do we injure our ACL? ACL injuries occur in sports that involve agility or contact, such as gymnastics, basketball, football, or rugby. Now, around 80% of ACL injuries occur while the athlete is landing from jumping, changing direction, or decelerating suddenly. When you injure your ACL, frequently you'll hear a pop or a crack sound in the knee. This is followed by swelling and inability to weight bear on the affected leg. Also, people do report that they will have difficulty bending the knee. Now, if you suspect that you have an ACL injury, please do go see a physiotherapist or an orthopedic doctor who will be able to perform necessary assessments to diagnose the injury. Now, an ACL tear unfortunately does not heal and it can result in an unstable knee. Now, contrary to popular belief, not all ACL injuries require surgical intervention. There's one high-quality study in an adult population that has shown equal long-term outcomes between those who had reconstruction and those who just had exercise rehabilitation alone. Now, regardless of what treatment choice that you eventually make, physiotherapy actually plays an important role in recovery. Now, the major goals of rehabilitation of the ACL injured knee are this. Firstly, to gain good functional stability. Second, to regain muscular strength. Third, to reach the best possible functional level. And lastly, to decrease the risk of re-injury. Now, the following is a brief summary of the phases that you have to go through to return to play. Now, if you have had an ACL reconstruction, it's important that you commit to at least 9 months of high-quality rehabilitation before returning to sport, comprising of 5 phases. Phase 1, the rehabilitation, involves recovery from surgery and can take place from week 0 up to 12 weeks of the rehabilitation process. Here, it's really important that you regain full knee extension and to get the quadriceps firing. At the same time, it's important to reduce swelling and to normalize gait patterns. Phase 2 and Phase 3 occur anytime between 6 weeks to 9 months in the rehabilitation process and involve strength and neuromuscular control, running, agility, and landing training. Now here you gain to regain muscle strength around the knee and hip, training single leg balance, single leg tasks, and also plyometric work. Phase 4 is when the individual returns to sport, and this typically happens between 9 to 12 months after the ACL injury, whereas Phase 5 is a stage where to prevent re-injury of the affected leg. Now, successful individuals following surgery generally return to sport between the 8 to 10 month mark. Now, this is provided the knee is free from pain and swelling during or after any functional sport-specific training drills. Now, the person will also need to show adequate strength and endurance for their specific sport. We hope this video has given you some insights on what rehabilitation after an ACL injury looks like. If you'd like to find out more, do come over to speak to our team of musculoskeletal and sports physiotherapists, and we'll be happy to assist you. Thank you!